Hi, my name is Dr. Kamran Ali. I'm the Associate Director of Thoracic Surgery and Lung Transplantation at Max Smart Super Speciality Hospital, New Delhi. And today we will be talking about lung nodules. Lung nodule is a very common radiological finding. So you may have some chest issues and you get an X-ray done or a CT scan of the chest done, or you may not have any issues and you may be undergoing a pre-employment health checkup and you find that there is a suspicious lung nodule on your scan. So are all nodules cancerous? No. So your doctor is going to evaluate your lung nodule based on three important characteristics. The first is the size of the lung nodule. So if the nodule is less than 5 millimeters, then 999 times out of 1000 it is going to be benign and there is not going to be any cancer in it. The higher the size of the nodule, the larger the size of the nodule, the higher are the chances of it being cancerous. So a 10 mm nodule is likely to be benign, but a 3 centimeter nodule is likely to be malignant. The second important characteristic that your doctor is going to look at is the shape of the nodule. So if the nodule is perfectly round in shape and has a fat density on the CT scan, it is very likely that the nodule is not cancerous. But if the nodule is spiculated, which means it's irregular in outline and has certain spikes radiating from it, there's very high possibility that that nodule is going to be cancerous, however small it may be. The third important characteristic that your doctor is going to look for is the patient-related data. Is the patient smoker? Yes, the chances of the nodule being cancerous are higher. Is there a family history of cancer in that patient? Yes, the possibility of the nodule being cancerous is higher. Is the patient elderly? So higher the age of the patient, higher are the chances of the lung nodule being cancerous. So if we look at these 3 points in great detail, we are able to screen out people who do not require unnecessary investigations like a lung biopsy or a PET scan, etc. And we can be sure that the nodule that we are looking at is not cancer. So if you've been diagnosed recently with a lung nodule, please contact your nearest pulmonologist or thoracic surgeon, because it is their job to bring you out from the place of uncertainty to certainty and to give you a clear diagnosis that whether your lung nodule is benign or cancerous.